We were using data to inform our programming, and we know from Barna Group has done several studies, and it has been shown that 25% of people will actually go to their pastor first when they're experiencing a mental health concern before they'll go to their doctor or before they'll go to a mental health counselor. So we thought, wow, we really want to make sure that we're equipping our pastors and the church with good faith-based mental health resources.
Thank you for tuning in to the Rescue Mission podcast, where we discuss real topics that affect real people. I've got Blake and Matt with me today. We're excited to have Carole from the Lutheran Foundation. Carole, how are you doing today?
I'm doing very well. Thank you so much for having me be here today.
Good. We're excited to have you here. So to give you a little context, I just think the story behind this is just really fun. So I get the Lutheran Foundation's email, and I got one that said, the Lutheran Foundation welcomes 24 new mental health advocates. And I thought, well, how exciting is that? And so I looked into it, and I saw that the Lutheran Foundation now has a total of 61 mental health advocates serving in 53 congregations in Northeast Indiana. And I read that, and I was so excited to hear what the Lutheran Foundation is doing with these congregations. And I thought, man, I've got all of these questions about this initiative. And at the very end of the email, it says, if you have any questions, you can send them here. And I thought, well, for now, I've got one question.
Just one question.
Can we get you on the podcast? And I think Carole emailed me back in the same day. And I was so excited. I was like, this is going to work out, because sometimes schedules happen and people can't make it. Or sometimes you get through the scheduling process and it just kind of fizzles out. And I was so excited that this one happened instantly. And I thought, well, this must be a God wink that we're supposed to have this podcast interview. So we're excited, Carole. So for somebody that's listening to this episode that has no idea what a mental health advocate is, could you tell us a little bit about how this initiative came to be?
Sure. So actually, I'm relatively new to the Lutheran Foundation myself. I started 3 years ago, 10 days before the pandemic hit.
Oh, my goodness.
It was like, welcome to mental health ministry, global pandemic. Yeah. So I'm a deaconess serving as ministry associate at the Lutheran Foundation, and that was a new position created 3 years ago to help equip our churches, Lutheran schools, and ministry organizations with mental health resources. And historically, the Lutheran Foundation had been providing the Speak Up Conference at the Grand Wayne Center in 2017, and then the Look Up Conference in 2019, and again in 2022. And at those conferences, we have been trying to convince pastors and church workers about the importance of mental wellness and bringing that into the church to reduce stigma of mental illness, so that people realize that the church is a safe space to talk about mental health and their whole person well-being. And so we were thinking about, we were looking at the numbers from our conference and seeing what were the results in our congregations as far as developing mental health ministry, because that was part of our conference, was saying, yes, we want you to develop mental health ministry, and here's a few resources to get going. Now go do it.
Yeah.
But then looking back and realizing, just a handful of churches were actually able to get some programming going around mental health. So we thought, how can we really get mental wellness talked about in the church and get people the care that they need? So we started from a different approach. Most of the pastors that came to the conference were very much on board with wanting to do mental health ministry, but realized they just didn't have the bandwidth to add something additional to their plate. And mental health ministry can seem very overwhelming because it's such a broad topic and encompasses so many different areas. And so I think a lot of our pastors and church workers were simply overwhelmed and didn't even know, how do we get started? So we thought, what if we do more of a grassroots approach and ask our pastors to nominate either a staff person or a lay person in the church to serve as a mental health advocate, and that person would be the one that's helping to communicate the importance of mental health in the church in collaboration with the pastor. So it's not falling all on the pastor's shoulders. He's in the loop, but he's not the one that has to, take that upon himself. So we've got someone that's passionate about mental wellness that's helping communicate the importance of mental health and then supply resources to the congregation. Because we're finding that half the issue is people just don't know what's available here in the community for help around mental health. And we are actually blessed here in Northeast Indiana to have such a variety of very good mental health resources. And so we just feel like the church can be a connector to let people know that, hey, you don't have to struggle alone. You have a church family who loves and cares for you, and we can do that to a certain degree. And here are some other professional resources related to mental health that we can help connect you to.
Mm-hmm. Well, I see you jumped over a couple of hurdles right off the bat by one is it's really hard to find somebody to talk to, right? Mm-hmm. Who do I call? Do I have to call a psychiatrist or a psychologist or a counselor or whoever? What do they believe? You know, if you're a serious follower of Jesus, then are they going to be a Christian counselor or anything like that? This allows you to have some sense of who the person is that you're going to right away. And if they're local, you know, the idea of people being, you know, local all over the place, the hurdle of trust, right, goes way, way down. So you can just sort of step over it, I think, pretty easy and say, this is somebody who's been in my community for, you know, X number of years, and there's already a level of sort of trust there. So that's brilliant. I don't know if that was something that you intended, but...
Well, we were using data to inform our programming, and we know from Barna Group has done several studies, and it has been shown that 25% of people will actually go to their pastor first when they're experiencing a mental health concern before they'll go to their doctor or before they'll go to a mental health counselor. So we thought, wow, we really want to make sure that we're equipping our pastors and the church with, you know, good faith-based mental health resources.
Yeah. So for a long time within the church, there has been a stigma around mental health to where people have been afraid to talk about it. Why do you think it is that, and it's a good thing, why do you think it is that people are beginning to become more open to talk about that within the church? I mean, as we're seeing, there's 53 congregations in Northeast Indiana that are nominating mental health advocates. Why do you think that stigma is going away?
Well, I think it has taken a lot of groundwork. So again, I mentioned we've had 3 big conferences around this topic and exposing more people to the idea about the importance of doing mental health ministry. And so any change in ministry is slow, as you guys know. So it takes time, right? So it's not something to just kind of snap our fingers and it's happened overnight. You know, we've been laying that groundwork since right before 2017, actually.
Okay. So to get into the nitty gritty, what is a mental health advocate and what is it they do? What is the role they provide in a church?
Sure. Well, again, the mental health advocate is somebody that their pastor has nominated and registered with the Lutheran Foundation. So some of them are professional church workers, and others are lay people who are just passionate about mental health. And it could be that they have lived experience with mental illness themselves or have a family member with mental illness, and so they're very passionate about informing people about care, providing care. So once they're registered, we've had an orientation session for them, so back in April, for a couple of hours just to kind of get them on board and help them better understand their roles. But basically, they're a communicator, a liaison between the Lutheran Foundation and their congregation. I serve as a facilitator, and I meet with our advocates on a monthly basis via Zoom. We found that to be a very effective platform because we serve 10 counties here in Northeast Indiana, and so we have some mental health advocates as far away as Huntington, Wabash, for example, Fremont and Angola area. We just don't want to have them have to drive in every single month. That's a long drive. So we thought, well, we'll provide it conveniently on Zoom, and that way they're able to get all the information, and then we're able to meet also quarterly in person at the Lutheran Foundation if they want to. So it's not mandatory, but we just provide that extra opportunity for them to come, receive extra educational information and trainings, and meet the other advocates face-to-face, and be able to share ideas and resources and collaborate with one another. That's a big benefit of meeting in person. It's just that face-to-face contact so that they realize that they're not a silo, in amongst themselves,
Yeah.
that they actually have other people that are passionate about mental wellness, and that they can share ideas and collaborate and work with one another. So the majority of our advocates are not mental health professionals at all. Some of them are. We do have some that are licensed mental health counselors. We have a couple that are medical doctors. We have several that are RNs or other types of nurses. We have some who are social workers. So we have some that do have some background or some training, related to mental health. But the majority are just, regular lay people, like you and me, or a pastor. We do have a few pastors that did register themselves as mental health advocates too. And of course, they have received some pastoral training, at the seminary related to mental health. But we provide some basic foundational education for them. So we have our Look Up Education Series events, including webinars that we have quarterly and other trainings at the Lutheran Foundation that we provide. We also offer free of charge either mental health first aid or youth mental health first aid, QPR suicide prevention training, companionship training.
Wow.
And they're not mandatory for the mental health advocates because, many of them already have, professional degrees. But for those who would like to get that foundational level of education around mental health and mental illness, we provide those for free. And then in the monthly meetings, I just help provide them with additional resources, materials, connect them to various agencies here in town that they might want to let their congregation members be familiar with.
So
can we stop just for a hot second? And like you said that so matter-of-factly.
Yeah.
Right? There are a ridiculous amount of deep resources here.
There are.
And you said they're for free. Right? That's a big deal. How's somebody going to access those?
Right. Well, for example, our Look Up Indiana website has factual and clinical information related to mental health, but then it's also been my privilege to curate faith-based mental health resources on there, including our 2023 Congregational Mental Health Toolkit, which contains pretty much anything that a church needs to promote mental wellness. So there's a Bible study on resiliency. There's a sermon on mental health. There are prayers related to mental health, bulletin inserts, all sorts of things.
Wow.
A hymn.
Can I just say that we have actually provided that for all of our staff?
Wonderful. Thank you.
Yeah.
Yeah.
So how does someone go about becoming an advocate? And also, how would someone know that it's part of their congregation or church? If maybe, I know a lot of people are still attending online, or maybe they're not able to make every Sunday. How could they be made aware or go and find out themselves if their church is doing something with this?
Right. So we've encouraged our mental health advocate congregations to actually have an installation service for their mental health advocate so that their congregation member becomes aware that, this is a new program that our church is participating in, and here's our advocate, so they can see who it is, right, that they can go to. Some of the advocates have already formed committees or wellness teams, and we've said, great, if you would like to have your team installed, great. Other times they've put that information in their bulletin or their newsletter as well to say, hey, we're participating in the Lutheran Foundation's Mental Health Advocate Initiative, and this is what it entails, and here's our advocate and or our wellness team members. So if you have, questions or any concerns or you need some resources, please feel free to reach out to them.
Yeah, I think that's incredible that you're providing that toolkit. So if they want to take those first steps toward it, they can get on the website. And I think the numbers prove that this is a need within the church, that these numbers are growing, that the congregations are going up. Where do you hope to see this initiative go? So it's already off to a great start. I mean, what's kind of your vision or your dream over, let's say, the next 5 to 10 years?
Oh my goodness. Wow. Well, with God, all things are possible.
Amen.
Right? And we know that this is in His hands and that the growth is His. So, boy, if I had a vision, though, I would really love to see, maybe in the next couple years, to see us go from 61 mental health advocates to maybe 120, double
Yeah.
it here in the next couple of years. And I'm so excited that this year we've been able to include non-Lutheran churches for the first time.
Okay.
So the first 2 years we did just kind of as a pilot, just among our 91 member Lutheran congregations to see how that would go, and it was successful. And so we thought, well, we've had a lot of congregations reaching out to us after the pandemic saying, they've seen increased need, especially among our youth
Yeah.
who are needing mental health assistance. And because there's such a long wait time now to get into some of the counseling agencies, the pastors and church workers are having to kind of step in to meet that need. And so they reached out and said, hey, we'd like to be part of this mental health advocate initiative. So we said, okay, well, let's explore that. And so we're pleased to roll that out. And we've got 10 non-Lutheran churches participating this year for the first time.
Wow, that's great. I think you hit on something that's a pretty big topic that we've talked about here a few times, and that's kids experiencing mental health issues and the youth, you could say. What would you say to a parent that's maybe struggling with a child that they want them to be part of the church body, or they want them to maybe go in through the services that you guys are providing to get the help they need? How would you encourage them to maybe reach out to that advocate, or even ask the child to, hey, go talk to Greg or whoever the advocate is there and see if they have anything they could help you with?
Right, and it's as simple as that, especially if they already have a relationship or a connection with that advocate. So sometimes the kids don't always like to do face-to-face conversation, right? And so it may be good to actually talk with the pastor first and get them connected to the mental health advocate, so the advocate can actually call that family, or if they make an effort on Sunday, to see that kid or to reach out to that kid and make a personal invitation just to sit down and have a conversation with them and maybe their family, and just kind of see, hey, the church cares about you and your family and your whole person health, body, mind, and spirit. And how can we walk alongside you in your wellness journey? The church has several resources here within the church, including pastoral counseling, and there's great resources that we can help connect you to, whether it's a mental health counselor, a Christian counselor, or other agencies with lots of different support groups such as NAMI Fort Wayne or Mental Health America.
So I think it's encouraging because at first you can kind of think about this and you can think about the mental health advocates. And my thinking went towards adults in your congregation that are experiencing mental health, because a lot of time that's where the attention can go, because I think the adults can be more open to talk about it. But it's encouraging to hear that this is almost like a form of youth ministry. Has it been that way from the beginning, targeted towards, not specifically targeted towards youth, but reaching out to youth as well?
To some degree. I think originally the majority of our resources were aimed towards adults, but we've been having more and more congregations say, hey, the need is increasing among our youth, and so we really need some more specific faith-based youth mental health resources.
Sure.
Can you help us out? So fortunately, we've been able to locate or find some of those. So Mental Health Grace Alliance, for example, has a wonderful workbook called Redefine Grace. Yeah, I'm glad you're familiar with them. And so I've been encouraging our pastors and youth pastors to utilize the Redefine Grace workbook with their youth group to actually go through it together, because it's helping them understand their identity in Jesus Christ as the foundation for how they see themselves and the world and how they manage stress in their life. And it has a great chapter in there on not allowing social media to affect their sense of self, because it's rooted in their baptismal identity in Jesus Christ. So I just love their resources. So that's one, for example, one of the resources I've been pointing people towards to help our youth.
Yeah, I can back that up. I went to the Look Up conference last year and actually went to the breakout group where the guy that started that initiative was, and he will even about those workbooks. They have several workbooks they provide, and for free he'll come on a Zoom call with a pastor and kind of give an overlay to their whole program to them. And I've recommended that book to countless people. I've got it sitting in my office right now. It is an incredible workbook, and through the Lutheran Foundation there's several resources like that I've found out about. There's the spiritual first aid that I think you and I have talked about a little bit before, Matt. That's another great resource. And so, Carole, we were so excited to connect with you today about the Lutheran Foundation and this initiative that you've got going with the mental health advocates. So just to give somebody some next steps, if this is something that they were interested just in looking into or applying for, where would they go and how would they go about doing that?
Well, they can send me an email at Carole, Carole, at the lutheranfoundation.org, or they can call my direct line there, 260-458-2115.
Well, and we have evidence that she does write back pretty quickly.
She is very prompt at replying to emails.
I try.
Well done, Carole.
Yeah.
Thank you.
Well, we're excited because the Rescue Mission and the Lutheran Foundation have had a long relationship, and you guys have been really good to us. So we're just so thankful for that. And you have not simply just sat back and supported us from afar, but you've really been able to come in and give us a lot of different tools. So we're super thankful all the way around.
Well, it's our pleasure. Thank you so much.
Yeah, thanks for coming on the podcast today, Carole. If you enjoyed this episode of the Rescue Mission podcast, we ask you to consider leaving a review, subscribing, following whatever platform you're on. We'd love to have you keep up with us and what's going on with the Rescue Mission podcast. Thanks for listening.